The shuttle possesses three basic adjustment mechanisms, one for resistance and two for range of motion, which independently adapt to each patient. The first is related to resistance. Resistance is provided by 8 elastic cords, each of equal tension, which are stored under the carriage. They have an overall resistive range of 12 pounds with one band at initial hookup, up to 240 pounds with all 8 bands attached at maximum stretch. Elastic cords can be easily added or subtracted. The patient doesn't have to get off the shuttle. As an end-stage goal for strengthening, athletes can progress to plyometric drills. However, ask any athlete who is recovering from an ACL how excited they are to begin jumping full weight bearing. It's much easier to introduce plyometrics on the shuttle, which offers a more controlled and safer environment. Both flexion and extension can be controlled when doing strengthening activities on the shuttle. By sliding the platform forward toward the patient, you can see that flexion is increased, and conversely, sliding the platform away decreases flexion. These elongated bars, unique to the shuttle, allow you to easily pull the kick plate all the way to the end, so you can accommodate very tall individuals and still securely lock the kick plate into place. This range of motion control, or ROM control, limits the user's stroke length, or distance traveled, on the shuttle. Once initial flexion and extension are established, you can use the ROM control for patient-directed therapy. For example, use it with an overly eager athlete who tends to be a little too aggressive. If you're in a very busy facility, this also frees you to attend to other patients. Notice that these rings allow a slight bit of give. This will soften the stop if the end of the stroke is reached too abruptly. For objective analysis, the progress monitor strip will assist you in quantifying and tracking your patient's progress in terms of range of motion, or distance traveled, and weight-bearing ability, as reflected in resistive force. In addition to facilitating early rehab activities, the shuttle excels in the quality of versatility by effectively optimizing every square inch of space it occupies. Patients with acute conditions to the most physically elite can utilize and benefit from the shuttle. A variety of activities for closed kinetic chain strengthening, range of motion, flexibility, stabilization, P&F patterns, proprioception, and plyometrics can be performed. Even cardiovascular programs can be designed to improve the overall fitness of the rehabilitating individual or the athlete in training. With the integration of various accessories, the shuttle's applications can be expanded to the upper extremities, torso, and back. For example, by utilizing the P&F towers, you can control the angle of pull for diagonal P&Fs for both the upper and lower extremities. Other uses of the towers include upper body strengthening exercises such as lat pulls, seated row, chest press, or almost any other upper body activity you can imagine. You can also perform upper body activities using the kick plate. Back patients will also benefit from upper body exercises on the shuttle because the horizontal movement demands that the patient stabilize themselves. However, for patients who don't have sufficient strength to perform these activities unsupported, we offer the back support belt. So, with a little imagination, the exercise possibilities on the shuttle are virtually endless. For instance, going down a set of stairs can be a real challenge for some people. With minimal resistance and distance traveled, proprioceptive exercises involving small, or as we call them, soft plyometrics, can be an invaluable exercise to stimulate that essential feedback for the various mechanoreceptors surrounding the joint and within the musculature. Other proprioceptive activities that focus more on balance are easily achieved on the shuttle. With 2 feet on the wobble board, this simple closed chain exercise becomes an activity for stabilization, affecting the entire kinetic chain right up to the pelvic floor, a particularly safe and effective exercise for lower back patients. As you've seen, the shuttle is an extremely versatile and functional piece of equipment that can be customized to meet the specific needs of your practice. Our 5-year warranty speaks to our quality and durability.